Hello, my name is Ansley Williams. I am a senior nursing student at Longwood University. In order to complete our senior preceptorships, we were assigned to a facility where we had to complete 170 clinical hours with our preceptor, and we were required to find something on the unit that would positively benefit from change. Throughout my time at Chippenham Emergency Department, I noticed the unit would greatly benefit from better staffing patterns. Registered nurses have consistently been recognized as one of the most trusted professions across the United States. To uphold this honor, the RN staffing shortage must be addressed. In the emergency department at HCA Chippenham, there is an obvious shortage of registered nurses. However, this shortage is happening across the country. When patients come into the unit, they are waiting to be triaged and either admitted to the hospital or discharged back home. The shortage of RNs can lead to an overcrowding of these patients. They become really dissatisfied with the care that they are receiving, and also an increased risk of errors for the nurses. Not only is there a negative impact on the patients, but the nurses themselves that are working face increased amounts of stress, burnout, and fatigue. The hospital system also faces a decrease in nurse retention and recruitment. So the researcher determined an issue that would benefit from change in the HCA Chippenham Emergency Department. The researcher then consulted several staff members within this department, and they all concluded that the unit would greatly benefit from more staff nurses, and rather than just filling those spaces with travel nurses. Information was then gathered by using scholarly sources and several different reliable websites. These sources were all limited to the past 5 years, so from 2018 to 2022. The keywords used in many of these searches included emergency department overcrowding, effects of decreased nurse staffing, and things like that. The researcher then conducted a literature review, reviewed several articles related to appropriate registered nurse staffing, the impact of overcrowding, specifically within the emergency department. The research found that the ED is often the patient's first contact with the hospital. So you really want them to have a good experience. You want them to be treated in a timely manner. So for the rest of the hospital to run effectively, adequate staffing and patient satisfaction needs to begin in the emergency department. Most of the articles found that patient care was drastically improved and medical errors were decreased with adequate staffing throughout the emergency department. When nurses are, running around and quickly trying to get tasks done, it's really easy to make simple mistakes, but also really critical and potentially fatal ones. It was also found that patients are likely to leave the emergency department without being seen due to the increased wait times and overcrowding of patients throughout the emergency department. And this was definitely seen at Chippenham. Patients would become very frustrated that they hadn't received care yet, or even sometimes there would be so many patients on the boards that they would sometimes just get taken off by accident because you might have thought they had left or something like that, but they were really still waiting, and so they never received the care that they came in for. So in order to hopefully shed some light and initiate change for this problem, I have chosen the Kurt Lewin's force field theory of change. So for the first stage, or the unfreezing stage of this theory, a staffing committee should be created between nursing staff, such as the charge nurses and nursing supervisors, to discuss this staffing issue. This can help to determine the driving forces behind the issue, such as the need for more nurses within the emergency department, and the restraining forces, such as the hospital finances, the lack of nurses, and the new graduates applying for these positions. It is important that all of the appropriate individuals are involved in this stage in order to work towards change together. The second stage is the movement stage. So this stage would include implementing strategies to help start bringing more nurses into the department. So improved staffing patterns within the emergency department will help the overall flow of the hospital and ultimately improve the patient experience and their satisfaction, as well as alleviate some of the stress on the nurses themselves. At this stage, it would be important to ensure you have the full support of the facility and begin implementing changes that would bring in more nurses. These changes can include incentives for your current nurses and enforcing residency programs for new graduate nurses to hopefully help with that retention of nurses over time. In the final stage, which is the refreezing stage, this is when adequate staffing becomes integrated and stabilized within the emergency department. In order for this staffing pattern to last, the facility must maintain the changes that help with retention and the future recruitment of nurses. It would be important for the staff nurses, the charge nurses, and the nursing supervisors to be members of the staffing committee because their continued support and encouragement will get buy-in from the other nurses because these are the individuals that are on the front lines. Their opinions are valued, so other nurses will see that and, you know, they will have gained their respect. They will be a lot more likely to stay within the department, but then it also really helps with the recruitment of new nurses to see that their own people, like their own nurses, are helping to advocate for them. So there are still several barriers to staffing in the emergency department. Some of these can include the increased stress, burnout, and fatigue that was mentioned. Money, that's always an issue. So there are also several retiring nurses out of the field, but then we don't have enough new grads to replace all of them. So we have less individuals going into the field, and then we have a significant amount of retiring nurses. There are also several nurses leaving the field because of the amount of time that they're having to spend on non-nursing tasks. So they're leaving to find positions where they are focused more on just their skills or honestly leaving the field altogether. So while we have all those barriers, we do have several solutions. And while many of them have already been briefly mentioned, these would all be very effective in alleviating the understaffing of the emergency department and overcoming some of the barriers that are currently preventing this staffing pattern. So one solution would be to hire less travel nurses and more staff nurses. I know specifically at Chippenham, the travel nurses do not have the same capabilities as a regular staff nurse. So, for example, they are not able to work in triage. So some nights you might have way more staff nurse or way more travel nurses working than staff nurses, but they can't work in triage. So you might have one staff nurse in triage. So an overwhelming number of patients come in, and that's where, the overcrowding and the patient dissatisfaction and all of that begins because you can't put travel nurses in triage or they can't sign off on certain things. So patient care is ultimately being delayed. So really the hospital would benefit from more staff nurses. We can also improve the incentives for staff nurses in order to aid in their recruitment and their retention. So we could increase their hourly pay. We could offer sign-on bonuses. If you commit to a certain amount of years, with that facility, you could potentially be eligible for another bonus. Another potential solution would be to hire LPNs. While they can't do everything that the registered nurse can do, they do have a much wider scope of practice than, say, just your CNA or even a patient care tech. So ultimately, they would be a better asset to the facility because they do have a wider scope of practice, but eventually the facility could provide tuition assistance for them to earn an RN degree. So it would ultimately benefit them in the long run. Also offering residency programs for new graduate nurses. This would definitely help in the nurse retention because it would really help them hone in on their skills and practice and just really gain some extra confidence before being sent out on their own as a nurse. And also limit mandatory overtime. This would just really help in preventing the burnout, and more nurses would be willing to work if they were not required as much mandatory overtime. Some good ways to get this information out there and just make everyone aware of what's going on. The hospitals can put this on their website, and they can also include it with the job listings. So they can say, hey, we're offering this amount of money as a sign-on bonus and list, all their other benefits and things like that with it. You can also send out an employee email with all of the new incentives being offered. So that way everyone will see it. Everyone's aware of what's going on. Everyone's included. and also small team meetings, like focus groups, because I feel like people are much more likely to pay attention and listen and engage in the conversation in smaller groups. So this would also help get feedback and kind of see what everyone else is thinking, and just really get their opinion on things. But it would be a great way to get the information out there.